Is PGT safe or will it harm my embryos? This is a question I get asked all the time when it comes to pre-implantation genetic testing, otherwise known as PGT. Okay, first off, what is PGT? It is a procedure that is done commonly now, routinely with IVF, where a small section of the outer part of the embryo is removed or biopsied using a laser, and then those cells are sent off for genetic testing. This is super useful because so many embryos can have typos where there are missing or extra pieces of chromosomes or whole chromosomes. This is the #1 driver of why embryos don't implant, and some embryos result in miscarriage. You can also test embryos for certain genetic disorders or mutations that run in your family to avoid propagating things like cancer-causing mutations to future generations. I am not exaggerating when I say that PGT has revolutionized our field. It's the reason we can confidently transfer one embryo at a time. It's made IVF more successful and have less complications. But how can you take a piece of the embryo away and have that embryo still implant and be okay, you ask? Here is what an embryo looks like on day 5 to 7 after fertilization. So you have 100 to 200 cells, which have clearly separated out into 2 cell types, the cells that are called the trophectoderm, that will one day become placenta if this embryo implants and results in a pregnancy, and the inner cell mass, which represents the cells that could become the baby if this embryo actually implants. When a biopsy for PGT is performed, it involves removing just a few cells of the total hundreds of cells that exist in the embryo. You do not go near the inner cell mass or touch it. This is probably the best designed, most recent study that actually drives home and proves the point that PGT is not harmful and does not hinder implantation of embryos. The main point of this study was to demonstrate that PGT can accurately predict abnormal embryos that don't have implantation potential, and actually 100% of the embryos that were found to be aneuploid in the study did not actually result in sustained implantation or live birth. Here's how the study actually proved the point. They compared 2 groups of patients. None of them knew any PGT results of their embryos. Rather, you had 2 groups where one underwent transfer of embryos that had undergone biopsy for PGT, but they were blinded to the results, so were the doctors. And the other group did not have their embryos biopsied, but they were matched according to the age of the eggs that the embryos were derived from, the thickness of the uterine lining, BMI, and embryo grading. Here are the results. 2 groups. Neither had their embryos selected for transfer based on PGT results. The study group that actually had the biopsy done for the purpose of PGT without knowing the results had a 47% sustained implantation rate versus the control group that had embryos transferred without having any sort of biopsy that had a 45% rate of sustained implantation. This trial very clearly demonstrates, and clinical practice and experience demonstrate, that the act of biopsying an embryo, removing just a very small number of cells from the outskirts of the embryo that never were destined to become the actual baby itself, does not hinder implantation potential of an embryo. So why are so many women sold this narrative that because they're in their 40s, their eggs are fragile, their embryos may not do as well with the biopsy? This is simply not true. In fact, I would argue that those are the patients that could stand to benefit from PGT the most by lowering their risk of miscarriage and avoiding unnecessary transfers that aren't going to get them to their goal. I think what people are really afraid of in the case of women in their 40s, women who have low ovarian reserve, is this idea of scarcity. They're worried because they're going to have a low number of eggs and maybe a lot of attrition going from eggs to embryos, because that can be age-related, egg quality related, that they may not end up with anything for testing. What if all the embryos are so slow growing, and wouldn't it be better to just put back whatever we can on day 5, even if it's super slow growing and it looks more like a day 4 embryo? Well, there's enough data now to suggest that very slow-growing embryos that don't meet the mark when it comes to the criteria for biopsying for PGT or freezing are most often very abnormal. Every case needs to be individualized. Every patient is different. And listen, I'm not someone that has done PGT on 100% of my patients. I have done fresh transfers using unscreened embryos in patients with a history of slow embryo development, especially younger patients where you're thinking there might be something else going on a molecular level. And based on age, maybe there's a slow-growing embryo in there that could be genetically normal. But in older patients, I really think we're doing a disservice to recommend a fresh transfer without doing PGT at the outset, just because we don't feel confident in the ability to grow eggs to embryos. I think what you're doing is effectively putting a patient on a path where they may be at higher risk of miscarriage, and that could lead to a significant loss of time if there is a detour of, let's say, 3 to 4 months. It can take time for miscarriages to resolve. And that just takes them further away from their goal and resetting the clock and being able to try again and get to another retrieval cycle. So I really think that the first line approach in today's day and age, in modern day IVF, really should incorporate PGT, especially in older patients where we really want to understand the quality of their embryos before we use them for a transfer.